speak from here, I guess. Can you hear me? I think it's, oh, okay. Okay, perfect. Okay, great. Thank you. So, yeah, my name is Umut, and I'm a medical doctor from Turkey. I actually graduated around 2000 in Turkey from the prestigious university medical school in Turkey. So, and then became an ophthalmologist after residency period. So, I did a lot of eye surgeries. I did good things there, but then I came to Canada 8 years ago and became a naturopath. But this is I always noticed that there is some deficiency in medical training and also modern medicine. But I didn't know how to complete that missing parts. So after coming to Canada, I noticed that there is naturopathic medicine here. But actually, before starting the school, I didn't know what I'm going to learn in the school. So then, after starting the school, I noticed that there are a lot of information we never trained it in medical school. So then actually in my practice now, I'm seeing a lot of conflict between MDs and NDs, medical doctors and naturopathic doctors. And then I started to think about this, why it's happening. Because I was in the same place in old age, but then I became a naturopath, and I noticed that there is some factors medical doctors don't know enough. So the first thing is this possibly medical training, because the medical schools, it's kind of so hard and so intensive trainings. There is no place to integrate like natural treatments. This is the first thing. And the second thing is they mostly focus on pharmaceuticals and surgeries. Maybe there is some, possibly there is some money issues there, because pharmaceuticals, the companies works a lot in that area. So, you know, the biggest budget in the world has pharmaceutical companies. So that's why they are working in that area a lot. So I didn't even know like about magnesium. We always get all information in our medical training, but only you can treat many things only adjusting the dosage of magnesium and giving this treatment to patient, and you can treat many things only with magnesium or vitamin D. Then you can add some things on it. Yeah, what I mean is there is some simple, easy things, basics of health, and if you correct that part, you can treat many things instead of giving like blood pressure medications, for example. So yeah, I can say the main reason maybe I can say some medical doctors don't embrace naturopathic medicine is they don't know how they can treat the disease with simple interventions. And also they, in my time, like 20 years ago, there was no enough scientific research behind these natural treatments. But now we can find many scientific studies about the natural treatments. So it is changing now. But I'm not sure if the medical training is changing. There is some suspicious part still there, because already the training is very intensive. I don't know if there's any place to implant this kind of treatments there. So and also yeah, there are some, especially in Canada. Actually, after coming to Canada, I get really sad, because the healthcare system is really bad. I feel bad for all people, all Canadians, because they don't get enough health care because of the system, because of the many things. And I believe naturopaths complete this deficiency in Canada. So therefore, naturopaths is essential, in my opinion, in Canada, because the patient needs to be listened, as TJ mentioned that. So in 10 minutes, 15 minutes, you cannot diagnose or you cannot understand what the patient experiences. So it is impossible for anyone, actually. Therefore, we need to listen to people like at least 1 hour to understand what's going on in their life. So yeah, this is another thing. I think, and these complete the big deficiency in Canada. And yeah, and for the training, actually the main thing is the training part. The naturopaths get trained 7-8 years. Many people don't know, by the way. This is a really long time and similar to medical training. Yeah, you can say almost we are getting enough around the same years, right, in Canada. So, and also, yeah, of course, the focuses are completely different, I can say, but we are learning the same topics there, like biochemistry, like pharmacology, like anatomy, yeah, the all things, physiology, psychology, all things. So after that, there are many exams actually. To get registered, we are taking a lot of exams. It takes maybe 6-8 months to complete all exams to get registration. So Canada has good regulatory bodies to check all system. Of course, there is some deficiency, especially some missing points there, but I'm not gonna mention that. But if you go any NDs, definitely if there is ND title on that person gets a lot training, a lot exams, which means. So therefore, naturopaths are very well educated in Canada. Because in my country, for example, Turkey or any other countries, even in Europe, I searched it a little, the training period is shorter than Canada. So, and the regulatory body also not quite strong like in Canada. Canada controlled everything very well on naturopaths. So yeah, this is another thing. Okay. So if we work together, definitely with MDs, everyone can get more benefits for the health. We need to work collaboratively with MDs to get more health in population, I can say.